Hello, everyone, and welcome to webinar series. Myself, Shanti here. And today's topic for discussion is all about interpretation of liver function test. As we must know, liver function test evaluates the liver health. And for this discussion, I now welcome none other our expertise, Dr. D. Chandrasekhar Garu, who is our senior consultant gastroenterologist and therapeutic endoscopist and hepatologist from Somajigoda Yashoda unit. I welcome you, sir.
Good afternoon, everyone.
Good afternoon.
Good afternoon, and we all are privileged to have you with us today.
Okay, thank you.
Thank you, sir.
Thank you for this
And
opportunity.
thank you, sir. Also, I'd like to welcome all our speakers speaker from Kodar and Chintal and from Yashoda Hospital, Somajigoda unit. So let us see what we have in the rest of the session. I'm just speakers, you can take your turn. Yes, Aarti, over to you.
Good afternoon. Myself, Farz Joseph, and currently I'm working as a staff nurse. So, as we all know, liver function tests are blood tests that measure the different substances produced by liver. As a staff nurse, we are sending the blood samples of patients in vacutainers for LFT. So, the LFTs are actually a function test, or most of them are just markers of liver injury. Or, user, can you explain what is liver function test?
Yes, sir.
Liver function is a blood test that indicates how the liver is functioning. So in this, different components are there. It is like bilirubin. Bilirubin is the excretory product of the heme. After the heme disintegration, that is converted to bilirubin, and the liver excretes the bilirubin. So if there is any problem in the liver, that is the bilirubin level is increased in the blood because of there is a dysfunction of the liver, and the liver is unable to excrete the bilirubin. And other are SGPT. Now it is changed to ALT, and SGOT
Yes.
that now is changed to AST. These are called alanine aminotransferases and aspartate aminotransferases. These
Yes.
are the enzymes where, when there is a severe liver injury, there is increase of these enzymes we see in the blood test. So another is the enzymes are alkaline phosphatase, and another enzyme is the gamma glutamyl transpeptidase. These are the enzymes where after the this mainly indicates there is obstruction in the biliary system. When there is any obstruction in the, like cholestasis we call. So if there is
Yes.
any obstruction in the biliary system, then the alkaline phosphatase and gamma glutamyl transpeptidase levels are elevated. But one thing, alkaline phosphatase is produced from the other organs like bone. So if the only alkaline phosphatase is elevated and the GGT is not elevated, probably that may be from the bone. So if both are elevated, then only that indicates the gamma liver problem. And one more thing, this aspartate aminotransfer is also not specific for liver disease. Even with muscle injury, it increases. Even with cardiac injury, it increases. So this is also not specific for liver problem. So only ALP and GGT, these are very specific for the liver problem. So other enzymes, they can increase in the other problems also.
Yeah.
So another is the lactate dehydrogenase. Mainly in the ischemic hepatitis, we see elevation of lactate dehydrogenases. So we have to, another parameters are like albumin. Albumin is produced by only in the liver. So if there is albumin is decreased, then that is mostly indicates the liver problem. But there may be other causes for hypoalbuminemia, like loss in the urine and loss from the gastrointestinal system. So we have to correlate all these things, then we can know whether the liver, how the liver is functioning. So not we have to not to depend on only on one parameter. We have to correlate all the things. Then only we
All the
can
parameters.
correlate the things, and then we can diagnose the liver problems.
Yes. So that was very valid information, sir. And we have just updated ourselves that SGPT and SGOT is no more called as SGPT, SGOT. It is all about ALT and AST. Yes. Over to you, Priyanka. I think most of the, your queries have been set by sir. But yes, what you wish to learn from sir? Yeah.
The LFT parameters, how it is an important for the we have.
Pardon?
Just be a little loud, Priyanka.
Can you repeat the question?
what are the LFT parameters of how it is important for the nurses to recognize how to
Okay.
identify?
Okay. The bilirubin is mainly indicates that is there is a problem in the liver excretion. Liver is not
Yes.
converting the bilirubin into the excretory product, so that's why there is an increase of bilirubin. So
Yes.
bilirubin, excess bilirubin indicate can indicate excess heme breakage, and it is not excreting from through the liver. So another is the if there is any obstruction in the bile system, biliary system, like if there is any obstruction in the CBD because of stones or tumor, then also there is a high increase of bilirubin. So in the if the bilirubin is very high and if the enzymes are not very much increased, that indicates most of the times any obstruction, that is cholestatic. And if the enzymes are
Yes.
very high and bilirubin is not increased very much, that indicates parenchymal liver disease. So liver parenchyma is more damaged than the excretory system. That is a biliary system. So based on this, we can know the where is the exact problem in the liver, whether it is a parenchymal disease, whether it is any problem in the biliary ducts, and if the in alcoholics we see a lot of elevation of GGT. So if the patient is presenting with the very high levels of GGT, that indicates alcoholism.
DGT.
So based
Yes.
on the, we can see all these tests and then we can analyze exactly where is the problem in the liver, and then we have to react accordingly.
Yes. So this was very important slide, sir. As you have mentioned, for the alcoholic clients, GGT is mostly raised. So do ALP and ALT raise also we see, I think,
We
for
see in the
ALD cases. Obstructive.
in the
Yes.
obstructive disease of the liver biliary system, we see ALP and ALT
Yes.
GGT
Yes.
elevation. Okay.
Yes. Going forward, yes, over to you, Varun.
Hello, sir. Good afternoon. Myself, G. Varalakshmi, Pranadhara Super Specialty Hospital in Chintal. Sir,
Hello.
how to know testosterone levels is important to LFT, and how to make know nurses are how to escalate to doctors which parameters is.
This is very important question because liver test also important, but along with the liver test, prothrombin time level or INR is very important because this albumin and prothrombin time is deranged because of there is problem in the synthetic function of the liver, because
Yes.
liver synthesizes lot of clotting factors. So if there is any liver problem, the protothrombin time is prolonged, and it
Yes.
indicates very serious problem in the liver. And if the INR is more than 1.5, that indicates a very dangerous problem, and immediately we have to inform the doctor. And albumin is also one of the synthetic factor from the liver that is produced. So if the albumin is low also, there is some problem in the liver. But prothrombin time is very important because it indicates very severe damage of the liver. And if the prothrombin time is improving, then we can tell the patient that your liver is improving. So this is very important because most of the clotting factors are produced in the liver, and the prothrombin time is prolonged in the liver problem. So this is
Yes.
very important test to diagnose the liver dysfunction.
Yes, because sometimes when we ask nurses what is normal PT level, they say PT normal range, but then they skip saying this INR ratio as well. INR,
Uh,
yes,
Rather than PT, it is better to look for INR,
INR,
because
yes,
INR is the standardized value. PT may vary
yes,
with the lab to lab, but INR is the, if the INR is more than 1.5, that indicates severe liver damage. So this
yes.
is the alarming
Warning signs.
function, the sign that the liver is severely damaged.
Yes. And we request all the nurses just to have this expansion of INR is international normalized ratio. So
Ratio.
please remember this. And yes, as Varalakshmi and you have said, yes. Going forward, yes. Priyanka, over to you.
Thank you, sir, for giving information and what is the action we have to take from the nurses, and the LFT is high means how do we have to recognize? Yeah, can you explain, sir?
So,
If the
just a minute, I'll just modify this, query. When you go for your bedside rounds and maybe previous, experience, like LFT, when the LFT raises, and you may see few nurses, they do not escalate
Mhm.
because maybe they do not escalate because they fail to recognize that these are critical alert which should be told to the doctor. So what kind of
Mhm.
little few tips you wish to give to the nurses, whether firstly what they should recheck, recognize? Yes, sir, over to you.
Okay. If the we have to see the LFT if there is any problem in the with the patient. If the enzymes are very high,
Yes.
and that indicates like ALT, AST, if they are into the thousands, that indicates viral hepatitis or sometimes in the ischemic hepatitis. So if there is any problem with the patient blood pressure, the blood pressure falls and there is ischemia to the liver and the enzymes goes very high. So if there are enzymes are very in thousands, then you immediately you have to alert the doctor and you have to check for the BP. And if there is any sensorium changes in the patients, that also indicates there is severe problem in the liver. And if there is INR is prolonged, is prolongation of INR more than 1.5, also it is a dangerous sign. And if the bilirubin is very high, and if there is patient complaining of pain in the abdomen, then that indicates there is some obstruction. That may be because of gallstones. So
Mm.
immediately you have to alert the patient. If there is any fever with the jaundice, then we have to immediately we have to order for some more tests like ultrasound, and to look for any obstruction in the biliary system that is causing cholangitis.
Yes.
So if there is any liver problem, some tests like alkaline phosphatase, GGT, and high bilirubin, it indicates there is biliary obstruction, and the patient may land into cholangitis if you neglect that biliary obstruction.
Yes.
And a patient, if the enzymes are very high, and the patient may land into problems like encephalopathy and hepatic encephalopathy and liver failure, acute liver failure. So if we see any enzymes very high levels, it is better to inform immediately. And if there is any problem with the like abdominal pain and fever, that also you have to inform the doctor.
To the doctor. Yes, yes. Yes, that was very valid information as nurses fail to recognize and escalate unless they know what is the critical and normal, and few symptoms also to be looked into. Yes, over to you. Further going, we have only few slides and then, yes, Arti.
Okay. So there are many factors that can affect our liver health, like obesity, stress, chronic inflammation, weak immunity, etc. So I have seen mostly the IT professionals with 12-hour desk work with stress are more prone to liver disease. Sometimes the LFT result will be normal. So does we can guarantee the normal LFT for good liver health? So how do obesity and stress impact liver health? Can you explain, sir?
Normal liver function is not like that. Is liver is normal.
Yes,
Sometimes we see a lot of fatty liver in the that sedentary lifestyle of people. So
yes,
like if they are doing only desk work and they are not doing any walking or anything. So normal liver function means it doesn't mean that liver is normal. With
yes,
the liver severe fat also LFT can be normal. So that we can diagnose with the ultrasound or MR elastography.
yes,
But obesity is the main cause for the fatty liver disease in the majority of people. So if there is any fatty liver in ultrasound, we have to do not only LFT, we have to do other tests also. And we have to, there are so many causes for the fatty liver disease. Now the nomenclature is changed. Now it is not called NAFLD. It is metabolic dysfunction associated fatty
yes,
liver disease.
yes, yes,
MASH that is called. So
yes,
we have to look for any risk factors like uncontrolled diabetes, any liver excess cholesterol can cause liver problems, liver fatty liver, excess sometimes thyroid can cause fatty liver. Sometimes this it is a metabolic syndrome. Metabolic syndrome means there may be problems like uncontrolled diabetes, obesity, thyroid problem, hypertension, dyslipidemia. So this is all. This liver is the one of the organ that is involved in the metabolic syndrome.
yes,
So obesity and stress also, with stress, most of the people they eat more.
yes,
So there is a chances of obesity is there.
yes,
So they eat like processed foods, like all this unhealthy food they eat, and they it may lead to fatty liver.
yes. So as you have said already, and Varalakshmi, if at all, I think yes. So yes, Varalakshmi. Then I will also, have my question from my end. Varalakshmi, over to you.
Sir, thank you, sir. Past slides and your like like such a nice information to us. So, two most common chronic disease, liver disease, are there. So, how can we can like rule out the as a nurse? How can we do the
Okay.
Okay.
Commonly, if you do the ultrasound, if there is any fatty liver, it can be related to alcohol or MASLD, that is metabolic dysfunction associated steatotic liver disease. So first thing we have to ask the patient whether he consumes significant alcohol or not. And after LFT also, we can know whether the patient is fatty liver is related to alcohol or non that MASLD, because in alcoholic fatty liver disease the GGT is very high, and even the AST-ALT ratio is also there is some change in the AST-ALT ratio. In
Yes, sir.
routine, in MASLD we see more of ALT than AST, but in alcoholic fatty liver disease we see more of AST than ALT. So if even with the patient lies with us also, we can, by the seeing the liver test, we can diagnose it is a alcoholic liver disease or a MASLD liver disease, MASLD related liver disease. So these all we can interpret with the LFT, and we have to be very careful with the MASLD, that is NAFLD, because insult stages, if you control in the insult stages only, that is very helpful for the patient, because it can lead to later it can lead to non-alcoholic steatohepatitis, that is called MASH. Then later
Match.
it leads to cirrhosis. So these
Yes.
are the progression of the disease. If you control the fatty liver in the early stages, it will not progress to all these serious conditions. Then last, it can lead to sometimes hepatocellular carcinoma also. So these are the steps of the developing of this MASLD in the chronic liver disease. So first MASLD, then fatty liver disease, then MASH, that is inflammation. Then next it leads to cirrhosis. Cirrhosis, the liver is normally it is like sponge like. The cirrhosis means
Yes.
it becomes hard like a stone. So next
Yes.
stage is if there is any fibrosis, there is chances of developing of hepatocellular carcinoma, liver cancer.
Yes.
Thank you.
Yes, and yes, Priyanka, over to you because it is a very important slide as the sir has explained a lot of fatal conditions if at all, liver health is ignored. Yes, Priyanka.
In hospitals, so many of LFTs they are doing the LFT screening is doing, but it is mandatory. And how much often we have to do the LFT test, and how they have to take care of regarding that. Can you
No, in
explain,
the
sir?
no, in the majority of people we see fatty liver, and if you do LFT, if the LFT is abnormal, in fatty liver disease sometimes it can be normal also. But if there is any abnormality in the LFT, there is like AST, ALT
Mm, mm.
abnormality. If the level is increased, we have to rule out other causes also, not only fatty liver. Along with the fatty liver, we have to rule out any viral diseases like
Right.
hepatitis C, hepatitis B. All this can also cause liver disease. So, as a whole, we have to see these tests.
These
So, we
tests.
have to first interpret with the liver test, and then accordingly we can do the further investigations.
Investigation, yes. Yes, Aarti.
As we know, a fibroscan is a quick, painless, and non-invasive ultrasound test, and it is helps to measure the liver scarring and fat buildup. So, over to you, sir. Is it an advanced procedure to prevent the liver disease problems?
Yes. Fibroscan is a very important modality in the management of liver diseases, because whenever any patient comes with the fatty liver, we advise fibroscan. Fibroscan mainly it feels the resistance of the liver, and we can know the how much is the what is the fibrosis of the liver. There are four stages of the fibrosis are there: F1, F2, F3, F4. If the patient is in F1 fibrosis, we don't treat with medicines. We advise only lifestyle changes. If the patient is obese, then we advise the patient to control the weight. If there is any uncontrolled diabetes, we tell the patient to control diabetes. In the F2, F3 stages, we have to give medicines. Some medicines like resmetirom, semaglutide, these are all FDA approved medicines. So we have to treat with these medicines. And if the F4 means cirrhosis. So accordingly, we have to treat these patients. So fibroscan plays very important role in the management of fatty liver disease. And
Prevention.
accordingly, based on the fibrosis scan results, we treat the patients.
Yes. So this is our last slide, and as we kept learning few complications and rays of LFT, and as you said healthy food also has to be taken. So sir, my query is what all foods can be avoided? Like as the slide says, these are the foods, and
Yes, yes.
nowadays whoever comes for ultrasound, everywhere they find grade 1 fatty liver disease, and it is common. It is very common among
Very
yes sir.
almost 90% of patients they have liver common.
Yes,
But
yes,
if it is in the initial stages, nothing to worry. But they have to be careful, and we have to
yes,
food all these foods we have to avoid, like fast foods, like any burgers, cheese,
yes,
and all we have to avoid, and we have to avoid processed foods, artificial sweeteners and sugars, refined carbohydrates, any packed foods.
yes,
Packed foods you have to avoid mainly. High fat foods like sweets, ice creams, chocolates, and alcohol definitely we have to avoid. And junk
yes,
foods like pizzas, burgers, and
yes,
evening
yes,
snacks like samosas and all. It is
yes,
better to avoid. And one important thing is they have to do the physical exercise at least 30 minutes per day. They have to
yes.
do the physical exercise and they have to lose the weight. That is the main thing that they have to do.
Yeah, thank you for your very valuable time, and I thank all the speakers also. We have just come to the end of the session, and I urge all the viewers to just refer www.Yashoda Hospitals for more health updates, academics, and also watch patient testimonials for evidence-based learning. Thank you, sir, and thank all the speaker, and we end
Okay.
the session. Thank you,
Thank you
sir.
very much. Thanks for the opportunity. Thank you.
Thank you.
Thank you, sir. Thank you so much, ma'am.
Okay.
Thank you.